Dr. Dance, it's a pretty complicated subject to break down, but essentially the medical community is fighting this PhilHealth fund transfer. The DOF says that these are idle funds, that it's better spent on other things, including, for instance, education, healthcare, and infrastructure. And yet, as I just read, the community, composed of more than 60 professional medical organizations, are up in arms against this. Tell us why.
Well, there are two basic reasons. No? First, and probably more important, we think it's immoral. And second, it's illegal. So, first yung immorality niya, no? There are so many people suffering because of, need for funds for healthcare. Napakarami pong naghihirap. Studies show na half of our healthcare expenses are shouldered from the pockets of patients. That's very high, 50%. We're the third highest in the Southeast Asian region. Natalo lang tayo ng Cambodia and Myanmar. So 50% represents a lot of suffering of Filipinos. No? It's also immoral kasi, excuse me, PhilHealth is an insurance fund. Parang ano yan, it's a sign of solidarity among Filipino citizens. No? Parang paluwagan. No? We each pay a premium every year para if something happens to some of us, they can use this fund, this pool of funds na nag-ambagan tayo. So kung ang government actually pays for the premiums, yung ambag ng mga mahihirap, walang trabaho, mga disabled, senior citizens. So pag tinanggal nila yan, that's their subsidy, the premium of these people who cannot pay. Then who is left shouldering the bill for healthcare? Di ba? Eh di yung formal sector, those who are actually paying. And many people in the formal sector, naghihirap din. Ang ating premium is now 5% of our salaries. So that's the first. It's very immoral. The second is it's illegal because the Universal Healthcare Act protects the insurance nature of PhilHealth. How does it protect that? Sinasabi doon, it shows there, hindi yan tulad ng DPWH budget or DTI budget na pag may natira, you can get it back. It's an insurance fund. So the Universal Healthcare Act specifically states, none of its reserve funds can go back to the national treasury.
Actually, we've talked about that second point, yung illegality at length with former DOF, USEC, Shelo Magno, and she explained it to us clearly. So let's focus on your first point, which is that it's immoral. Sabi mo, there are half of expenses of Filipino patients here in the Philippines are shouldered by people out of pocket, and it's the third highest in all of Southeast Asia. The current PhilHealth packages don't cover this, and what are some of these?
No, in fact, we only fully cover a little more than a dozen illnesses. Yung Z-benefit packages natin, like if you have a bypass or a transplant, and some hospitals have agreed to the fixed rate that will be paid by PhilHealth, yun covered. But there are thousands of other illnesses that are not covered. Dapat yung Z-benefit, yung zero balance benefits, should gradually increase every year because there are thousands of illnesses na hindi fully covered. Marami pa ring out of pocket like heart attack or stroke or pneumonia. Marami niyan still funded from the pockets of the patients themselves.
Okay, Dr. Dance, yun nga, since nagkaroon tayo ng universal healthcare, katuwang nun, nagtaas din ng mga contributions ng PhilHealth members. We are, I believe, on the 4th year. So far nga, earlier this year, nagkaroon na nga ng issue na pinoint out ni Representative Stella Kimbo na masyadong mataas na yung kinokollect ng premium, yung benefits hindi tumataas. Now, as a doctor representing these medical organizations, since kayo po yung nandyan po sa field,
Yes.
What do you see? Bakit po nagkakaroon ng excess funds yung PhilHealth to begin with? Where do you doctors, healthcare professionals, where do you think the bottleneck lies when it comes to spending for, basic health needs and
Well,
common
there are
illnesses?
many bottlenecks, but the main one is yung capacity to develop benefits. No? Benefit development, hindi yan simple na sasabihin mo, oh, bayaran kaya natin ang sakit na ito. Hindi eh. Benefit development entails counting. Ilan kaya ang magkakaganitong sakit? Magkano kaya ang tests na ginagamit nila at magkano yung gamot na ginagamit nila in a year? Gaano kadalas kaya sila kumonsulta? And then once you implement the benefit, imo-monitor mo yan kasi baka na-overestimate mo yung binabayad, or baka kulang yung binabayad. So benefit development is very complex and technical. It entails a lot of human resource. So one of the main problems is a lack of human resource for benefit development.
The DOF's response to this is that, number one, idle naman daw yung funds. They've issued several press releases to say that the funds are idle and should then be transferred, then be better spent in other programs that will benefit the whole population. And number two, the money that they're taking away now is in no way going to impact the benefits of the current members. What would you say to that?
Well, let me start with number 2. Kasi kung mababaw ang kaligayahan natin and we want to maintain the status quo, then pwede nating sabihin, anyway, it will not affect what we are already doing because we're hardly doing anything. So I don't think that's a good reason to spend that money. No, that money was unspent, but it belongs to the people. Alam niyo yung 500 billion savings na yan. Inestimate yan ng atin actuaries. Sabi nila, oh, this many people will get sick. This is how much they're going to need. Based on the past year, ganito dapat yung allocate natin. At hindi na ibigay. No? So, ibig sabihin, that's not a saving. That's a debt. Utang natin yan sa mga tao. And I think that's basic in accounting. You have liabilities. And that 400 or 500 billion is a liability. It's what we owe the Filipino people. So, ang nakalagay sa law, there are only 2 ways you can spend it, yung reserve funds ng PhilHealth. By increasing premiums and by reducing reducing premiums or increasing the benefits. Nakasaad yan doon sa law eh. So it's really protecting the insurance nature of PhilHealth. So hindi ho tama yun na dahil hindi nagamit, gamitin natin sa pag-build ng mga tulay. No? Hindi ho dapat gawing alkansya ang PhilHealth. No, na lalagyan natin ng maraming pera, singil tayo ng mataas na premium, wag natin gastusin. Ayan, may pambili tayo ng meron tayong pera para gumawa ng mga kalye at tulay and other EPAL projects.
Okay, Dr. Dance, nung Monday naganap yung rally, yung white coat rally ninyo sa PGH. Bukas, Wednesday, August 21, June na po yung second tranche ng fund transfer from PhilHealth to the national coffers. That's 10 billion tomorrow on top of the 20 million back in May. My question is, Regina already mentioned that we spoke to former Finance USEC Shelo Magno. Her group, marami din po sila, nag-file na po sila ng kaso sa Supreme Court. I guess my question is, meron din po ba kayong plano to file some sort of petition in the courts against this, or what do you plan to where do you plan to take this protest po?
Well, we'll take it to the streets if necessary. We'll do what we can. We don't think it's necessary to file another case kasi we have worked with our colleagues who actually signed to develop a case against DOF, PhilHealth, and the GAA of 2023. So I think it will be confusing if there will be many cases filed for the same case. I think what's being challenged is the constitutionality. So hindi kailangang maraming mag-file ng case na yan. But if we fail for tomorrow's tranche, then we'll work against the third tranche in October. If that fails, we will work against the fourth tranche in November. We will not stop working. Kasi that's our work. Our work is to protect the rights of Filipinos to better health.
Have you managed, Dr. Dance, to speak to the health secretary, the current one, Ted Herbosa, or even the head of PhilHealth, Mr. Ledesma?
Only through the Senate hearings. No? So yung Committee on Health headed by Senator Bongo held hearings on this. I think the main characters for the transfer are Congress, which authorized a law whose constitutionality is being challenged, overruling the Universal Healthcare Act, which prevents return of the funds to the National Treasury. That's the first. The second party, which is the DOF, ordered implementation, ordered PhilHealth to give 89.9 billion back to the National Treasury. And the third character is PhilHealth, whose board actually signed a resolution that they are granting the return of that 89.9 billion. So they are the respondents in the case filed at the Supreme Court.
Dr. Dance, sinabi nga po ni Finance Chief Ralph Recto na this will not affect the operations of PhilHealth. But from your perspective, what do you think are the potential consequences if matuloy na nga po itong second tranche of transfer? What do you fear the most how will this affect the healthcare system and the patients?
Well, so first, patients can expect less benefit expansion. Alam nyo, 400 billion looks great. But if we just pay for more benefits, ubus ka agad yan eh. For example, most of our expenses are for hospitalization. Pag malapit ka ng mamatay, PhilHealth will help you. But they hardly help for illnesses that led to the hospitalization in the first place. Mga gamot for hypertension and diabetes and other chronic illnesses. So, ubus ka agad yan. And there will be a failure to effect an immediate enhancement of those benefits. The second and an imminent danger, we think, is pagka natuloy ito at natalo kami sa Supreme Court, magiging alkansya na nga ang PhilHealth. We will overcharge and underspend so that politicians can use the savings for other projects.
Dr. Dance, will there be another white coat rally anytime soon? You did say earlier at the start of this interview na you will take it to the streets if you must.
Yes, and of course, alam mo, ayaw naman naming sabihin kami lang ang gustong mag-alaga sa mga kababayan natin, no? We want to believe PhilHealth also wants to do that. We want to believe that even DOF wants that. And of course, our legislators want to do that. So in the interim, we will continue communicating with them, talking to Secretary Recto, if possible. So our letter yesterday was for him and asking him to engage us so we can explain the situation. No? And then if it comes near to the release of the third tranche and still no progress, after talking to Recto, maybe the President, maybe the PCEO of PhilHealth, then we take it to the streets. We'll do whatever we can to protect the rights of Filipino people to healthcare regardless of ability to pay. Yun yung gusto ng universal healthcare, di ba? Regardless of ability to pay. Our analysis shows, alam nyo ba, something depressing. Ang mas nakakagamit ng ating PhilHealth benefits, hindi pala yung mahihirap. People in the highest quintile of wealth, yung pinakamayaman na 20% of Filipinos, they use PhilHealth privileges around 2 times more than those in the poorest quintile, the poorest 20%.
Yes, because
So
yeah.
something's really wrong and
Oh.
depressing with our system.
Oo nga
And we
eh.
aggravate it by reducing PhilHealth funds, which can be used especially for the poor.
Yes, I think that's partly because, of course, they're more educated, alam nila yung benefits, alam nila yung rights, right? They understand the membership tiers and what they're entitled to, whereas the,
Tsaka yung paperwork eh.
oh, it's
Ang
a lot
hirap
of
nung
paperwork
paperwork.
just to file for a small
Yes.
claim, for instance, right? So a lot of
Yes,
people
and
would get
access
turned off by
to
that.
healthcare. So may hospital benefits ka, but the nearest hospital is 4 hours away. Paano mo gagamitin yung PhilHealth benefits mo?
Correct.
So, there are many system problems that have not been solved, which make PhilHealth or universal healthcare, almost like a dream at the present time, 5 years after it has been passed. So we need really PhilHealth to step up in the delivery of health care services for the poorest Filipinos, especially.
Right. Dr. Dance, actually, after the groups filed that letter to Secretary Recto, today his office issued a press release, and I'll read part of it to you. Recto said he acknowledged the viewpoints of sectors that are concerned about the use of PhilHealth's unused government subsidy, but pointed out that the state has the responsibility to manage its resources properly so that it doesn't resort to more borrowings. Nakikinig naman tayo sa lahat na nagsasalita, nakikinig tayo sa mga medical practitioners natin, nakikinig tayo sa mga kumokontra, lahat pinakikinggan natin dahil ito ay ayon sa ating demokrasya, Recto said. Do you feel heard?
No, not at all. I think it's in one ear and out the other. Kasi, alam mo yung problem ng healthcare professionals, kaya kami nagsama-sama. Kasi kami yung nilalapitan ng mga nangangailangan ng tulong eh. So, they cry literally for help because a father is dying and the PhilHealth coverage is not enough. And we have to think of ways to help them. And almost every day, at least one patient in such a situation will approach each of us. Kaya alam nyo, ang bilis-bilis namin nagsulat ng letter na yan. Parang in 2 days, 60 organizations all saying we should sign this. We cannot just sit down and let this happen. I cannot. The last time we got, 60 organizations to sign so quickly because of such a big health issue was when the sin tax law was passed in 2012. It's happening again. The proceeds of the sin tax law are being challenged, and we need to protect it. Because it's meant to help those with less resources for healthcare. So no, we don't feel heard. We think parang lip service. What is lip service? We hear you. If there is no action connected to it.
Okay. We will leave it there for tonight, but we will check back in with you to see where you take this issue. Thank you so much for your time tonight, Dr. Antonio Danz, epidemiologist and academician from the DOST's National Academy of Science and Technology.